Types of brainstem strokes. I want to hit this, and then I'm going to talk the last thing about just going over stroke screen. But Weber's stroke, these are the ones that we'll see the most. Okay, Weber's stroke, midbrain, that's top of the brainstem, deep penetrating artery from that posterior cerebral artery. They're going to have an ipsilesional cranial nerve 3 palsy. So they may have issues with a lazy eye. They may have like almost like a Horner's type of presentation. So, and then they have a contralesional hemiparesis, okay? So they got, their eye is all over the place, lazy eye, and then opposite side, facial drooping, and then hemiparesis, right? The traditional could be flaccid, where they have weakness on the other side of their body, okay? That's top of the brainstem, but more medial. Ventral, which is the front of the brainstem, you don't need to worry too much about this, involves also the red nucleus, so they're gonna have more spontaneous movement, movement disorder type stuff. So deep penetrating artery, again, that posterior cerebral artery. They're also going to have that ipsilesional cranial 3, but then they're going to have contralesional involuntary movements. Tremor, hemichorea, hemiathetosis. So chorea is these quick movements of an arm, involuntary, or they may have this kind of writhing movements of the hands and that type of thing. But these are some of the most common brainstem strokes. And then the big one is your Wallenberg syndrome, right? Your pica, right? So the pica, lateral medulla, so lower part of the brainstem, they're going to have ipsilesional facial and contralesional body, hypalgesia, and therm anesthesia, okay? And what does that mean? That means that the opposite side of their body, they're going to feel less. They have reduced sensation to pain, reduced overall sensation. They're going to have reduced sensation to pain and temperature and those types of things. They're going to have an ipsilesional palatal weakness. But the big thing for you guys to remember, okay, is dysphagia, which is what? Difficulty swallowing, right? Dysarthria, difficulty talking, slurring, that type of thing. Nystagmus, we've just been talking about that the whole time. Vertigo, nausea, and a Horner syndrome. Okay, which remember the Horner's is that pupil, right? That's not responsive, that you're going to have lack of sweating on one side of the face and the whole thing. But just remember, they come in, they can't speak real well, they can't swallow, they got nystagmus, they're dizzy, they're kind of out of it. Okay, you could be looking at something like this, so you have to be very, very careful.